Good afternoon, everyone, and welcome to the Canadian 24-Hour Movement Guideline for the Early Years webinar. We are very happy to see a variety of participants from across Canada, and I did note on the registration list that we had people in alphabetical order from Alberta, Manitoba, New Brunswick, Newfoundland, Nova Scotia, Ontario, and Saskatchewan. So that's great. Thank you very much. And I know you were the quick ones to register because this second webinar filled up in about a week, so I'm glad you're part of it. And hopefully you did receive the slides. Yesterday morning I sent the PDF to everyone in an attachment that had all the connection information, so you can review that. Well, I encourage you to keep an eye on the box, the conversation box at the bottom. We will be adding some links as the presentation goes on. But first, I'd like to begin by acknowledging the Indigenous people who've been living and working on the lands across Canada for thousands of years, including in the lands where you're now watching this webinar from today. Our Health Nexus office in Toronto is located on the historical territory of the Wendat, Petun, Seneca, and most recently the Mississaugas of the New Credit First Nations. We're grateful to have the opportunity to work in this territory. Our main presenter today will be Dr. Casey Gray. She's a research manager with the Healthy Active Living and Obesity Research Group. Casey is part of the team that conducted the background research informing the development of the guidelines and coordinates the effort of promoting the dissemination and activation. So Casey will be doing the bulk of the presentation, but as soon as she's done that, presenting on how we came up with the guidelines and explaining the guidelines, then we're going to discuss implementation, and that should be an interesting aspect for your work, perhaps a little more practical. Now that we have the guidelines, what can I do with it? So I'll be, make sure you stay on, and then Casey will come back at the very end for a quick summary. And you're probably familiar with the Best Start Resource Center. Perhaps that's who you link through. So we provide information, consultation, resource training in the areas of maternal health and early child development, and we do that to service providers. Now, some of the documents we produce are for the general public, but they're intended to be distributed by the service providers. And all our documents are available for download on our website, which is listed at the bottom of this slide. We're a program of Health Nexus, so we're a not-for-profit organization designated bilingual in Ontario, and we're funded by the Ontario Ministry of Children and Youth Services. At least this webinar is funded by this ministry. So now I would like to have Kristen say a few words because they are also co-sponsoring this webinar.
Hi everyone, my name is Kristen Burfelt and I'm a project leader with OFIA's Physical Activity Resource Center, otherwise known as PARC. PARC is the Center of Excellence for Physical Activity Promotion in Ontario. We support physical activity promoters working across the lifespan, working in a variety of sectors including public health, community health, education, and childcare. We provide professional learning and networking opportunities, resources, and consultation services. And to learn more about PARC, you can visit our website at parc.ofia.net. And for more information on OFIA, we invite you to visit ofia.net. Thank you.
Thank you, Kristen. And now I will let Casey, Dr. Gray, talk to us about the guidelines and how they were developed.
Okay, thanks, Louise. So to begin with, I'm going to briefly cover the background and rationale for these guidelines, the methods that we use, the final guidelines that are the result of this work. I'll provide information on surveillance and monitoring, the dissemination, implementation, and activation plans, the evaluation, and the future research that needs to be done. Okay, so in terms of the background and rationale, as some brief background and rationale information, most of you will be aware that the early years is a critical period for development. So it's essential that we set our young kids off on a healthy trajectory. We know that nearly all Canadian toddlers and about 3/4 of preschoolers are getting 180 minutes of physical activity each day. So in other words, they're meeting the existing guidelines for young kids of that age. However, only 15% of toddlers and 18 to 24% of preschoolers are meeting the screen time recommendation. So these are from the individual guidelines that came before the 24-hour guidelines. And there are currently no systematic review-informed sleep guidelines for children of the early years. So you can see here in this diagram that physical activity, sleep, and sedentary time are considered on on this triangle. So you can see the bidirectional relationships between each of the behaviors. So there are relationships between sleep and physical activity and sedentary time and sleep, and there are also relationships between each of the behaviors and health. So in terms of each of the individual relationships, for example, we know that if a child is meeting the physical activity recommendation, then that's positive. That's associated with positive health outcomes. However, these relationships also are affected by each of the other behaviors. So, for example, that physical activity and health relationship, if the child is also engaging in too much screen time, then that positive relationship between physical activity and health will be attenuated. And similar relationships exist across each of the behaviors. So we've considered the different movement behaviors as existing across a continuum. So from very energetic play and energetic play on the one end, which you might also be familiar with moderate to vigorous physical activity, and on the other end, sleep, so and sedentary behavior, so the less activity, less energy expenditure is taking place there. So if we think of these behaviors as existing along a continuum, then we also know that these components are influencing each other, and there are interactions among them. So it's pretty clear from the evidence that we have that the whole day matters. And so the previous approach, where we were not considering the behaviors as existing along a continuum, but rather just in isolation, that was a misrepresentation of the importance of the integrated nature of the movement behaviors. So the take home is that the whole day matters. So you can see here physical activity and health textbook. So in 2012, Dr. Mark Tremblay and his colleague Dr. Haskell presented a development framework or a development structure for how they would recommend we go about creating guidelines based on evidence and best practices that exist for guideline development. So this is the reference for you here. And also included here is the reference to our specific process which followed that advice, and that's included in our special supplemental issue of BMC Public Health, where all of the papers that are associated with the guideline development process can be found. This is open access, so these are all freely available for you. So the first step in our process was Dr. Tremblay, who initiated this process in close work with Dr. Valerie Carson, who was the co-PI. They together established a leadership team which consisted of funders, research leads, and methodology consultants. And this took place in November of 2015. So those partners and funders included the Canadian Society for Exercise Physiology, our group, the Healthy Active Living and Obesity group at the Children's Hospital of Eastern Ontario, the University of Alberta Faculty of Physical Education and Recreation, Participation, and the Public Health Agency of Canada. So the guideline development panel was assembled, as I mentioned. It consisted of the leadership committee, research experts from across Canada, as well as international research experts, stakeholder groups, knowledge users, methodology consultants, target population users, so this was parents, and the parents that were included in our panel were other research experts who happen to have children of the early years of their own, so we could get those perspectives involved in the development of the guidelines as well, and project managers. So for our methodological consultants, we were advised on best practices in terms of the agree-to framework. So this is the appraisal of guidelines for research evaluation instrument. And this instrument is used so that someone who wishes to use the guidelines or to follow the guidelines can look back at the process used to create them and decide for themselves if it was rigorous or not and if they would agree with the conclusions that were drawn. So it's very much about transparency and about following best practices. So we were going to be assessed based on these guidelines at the end, and so we had experts advising us as to how to follow these guidelines from the outset. We also had experts advising us on the use of the GRADE framework. So this is the Grading of Recommendations Assessment, Development, and Evaluation tool. And this is used to assess the quality of the evidence found in the systematic reviews, which were used to inform the guidelines. So we hosted a guideline development panel meeting in February of 2016. At this meeting, the guideline development process was outlined, the responsibilities and timelines were outlined. We introduced the methodology consultants to the group and explained what their responsibilities would be. We heard from international delegates who were there to help inform our process, but also to listen and bring back the information from our process in order to consider whether they might follow a similar process of creating 24-hour guidelines in their own countries. We finalized the process of evidence gathering. So we specifically developed our research questions, decided what outcomes we would look at, and that was used to inform the development of our systematic review. We established the timelines that we would follow and planned for knowledge translation, dissemination, and evaluation. So the evidence then that informs the guidelines consisted mainly of the development of 4 systematic reviews. So these looked at physical activity, sedentary behavior, sleep, and a 4th review that looked at combinations of movement behaviors in relation to health outcomes or health indicators. We also conducted compositional analyses to look at the compositions of behaviors in relation to health outcomes again. So for the systematic reviews, the health indicators that we examined are listed here, and these were considered as representing a holistic picture of health. So we have physical indicators along with cognitive and well-being indicators. So all of the reviews included most of these outcomes, but not all of them. So for example, the sedentary behavior and physical activity reviews didn't also include those behaviors as outcomes. Those were only included in the sleep review. The process for the systematic reviews, they examined apparently healthy infants, toddlers, and preschoolers. We searched online databases for relevant articles that met our inclusion criteria. There were no study design limits applied. We only examined English and French articles for feasibility reasons. We used the GRADE framework to assess the guidelines and the quality of, to assess the systematic reviews and the quality of evidence included in the studies. And this was done by health indicator and by study design if it was possible. So overall, across all of the 4 systematic reviews, we found 34,000 studies that were screened. Of those, 271 papers were included. We were only able to do 1 meta-analysis because the studies were so different, the outcomes were so different, the the ways that they measured the outcomes were so different. And so for those that we were not able to do a meta-analysis, we performed narrative synthesis. So on to the findings for each of the systematic reviews. For the physical activity systematic review, we found 96 studies. There were 71,000 participants included in those studies. They were conducted in 36 countries. The quality of evidence ranged from very low to high. And this has to do with the design of the studies that were used and the confidence that we can have in those study designs. So a high quality study would be a randomized controlled trial that was very well designed. And a low quality study would be a cross-sectional study because we would not be able to assume that causation were happening in those kinds of study designs. So it doesn't mean that the studies were poorly conducted, it's just that it's a weaker starting point. So we still do have confidence in the evidence that we found. So the key findings from the physical activity systematic review were that specific types of physical activity, total physical activity, and physical activity of at least a moderate to vigorous intensity were favorably associated with multiple health indicators and with evidence that more physical activity tends to be better. So there were not every single kind of physical activity that was examined was associated, but there were some types that were, and of those, more was better. For infants, we found that 30 minutes of tummy time per day while awake appeared to be beneficial for motor development. So the citation for that systematic review, if you wanted to dig into the types of physical activity a little bit more or any of the other elements, then you can see that here. And it's open access, and Louise has provided the link for you on the side in the conversation box. The sedentary behavior systematic review also included 96 studies. There were almost 200,000 participants in those studies, and they were conducted in 33 countries. The quality of evidence ranged from very low to moderate. The key findings from this systematic review were that objectively measured total sedentary time seemed unrelated to adiposity and motor development. So that's when we were looking at something like accelerometry, for example. However, time in front of screens was associated unfavorably with adiposity, motor and cognitive development, and psychosocial health. So more time in front of screens had unfavorable effects on those indicators. We found also that time in car seats and strollers, and also time in the supine position, which means lying flat on the back, that those were associated with unfavorable adiposity and motor development, or that they were unrelated. So there were relationships showing that that was a negative behavior to be engaging in, or null relationships, but we did not find any relationships that showed those behaviors were positive or favorable. And finally, we showed that reading and storytelling appeared to be associated with better cognitive development or no relationship. So these findings can be found in the BMC Public Health Special Issue as well if you're interested in getting at more information here. The sleep systematic review included 69 studies of almost 150,000 participants. They were conducted in 23 studies. The quality of evidence for the sleep review ranged from very low to high. So generally, shorter sleep durations were associated with higher adiposity, poorer emotional regulation, impaired growth, more screen time, and higher risk of injury. There were unclear associations with cognitive development, motor development, physical activity, and quality of life and well-being. So we didn't find any consistent evidence of an unfavorable association with longer sleep duration. The results of this systematic review also included here. can be found in our BMC Public Health Special Issue. Finally, the combinations of movement behaviors. So the requirement to be included in this review was that there would be 2 or more behaviors. So any combination of physical activity and sedentary behavior, for example, or sedentary behavior and sleep, or physical activity and sleep, then it was eligible for inclusion here if, in addition, they also had a relationship examined with one of our health indicators. So there are many studies that look at combinations of behaviors, but only 10 studies that we found that looked at combinations of the behaviors with the health indicator. There were about 7,500 participants included in those studies, and they were conducted in 5 countries. The quality of evidence was very low to moderate. So in terms of relationships between ideal combinations of physical activity and sedentary behavior, so we say ideal combinations because they weren't consistently described. So it could have been higher intensities of physical activity or greater durations or higher frequency, but we didn't have a way of more concisely saying so. So ideal combination really reflects that this is the best case scenario of whatever way they measured it. So for physical activity and sedentary behavior, it showed that favorable motor development and fitness in preschoolers was associated with these ideal combinations. Favorable adiposity or unrelated in toddlers and preschoolers, and unrelated to growth. So again, we don't have any unfavorable relationships that we're seeing with the ideal combinations of these behaviors. Ideal combinations of sleep duration and sedentary behavior was associated with lower adiposity in infants and toddlers. And again, no unfavorable relationships. The findings of this review can be found in our BMC Public Health Special Issue. So in addition to the systematic reviews, we also conducted compositional analyses. And so the reason for this is that we had limited evidence looking at integration among the behaviors from our systematic reviews. And so this was a way of getting at some of these questions using Canadian representative data that we had available in the Canadian Health Measures Survey. So for some additional context, movement behaviors have been traditionally assessed in isolation, but because the constituent parts explain the full 24-hour period, any change in one behavior must be done at the expense of another. So for example, if we tell people to increase their child's energetic play or moderate to vigorous physical activity by 15 minutes, then that has to be done at the expense of 15 minutes of something else. So that could be sleep or sedentary behavior or light play. So taking time from sleep is probably not as good for them as taking it from sedentary time, for example. Traditional statistical procedures can't address this geometric reality and probably may produce incorrect results. So the confined space of the 24-hour period needs to be handled in a particular way in terms of statistics, and the recommended procedure for doing that is compositional analyses. So in this analysis that was done for this purpose for our guideline development process, each behavior represents a proportion relative to the other behaviors instead of the assumption that they're independent from the other behaviors. So if you can imagine that together they consist of the full 24-hour period, and each part, any movement in each part would impact the other movement behaviors, or the time spent in the other movement behaviors. Okay, so the objectives of our compositional analyses were to explore the combined associations of the composition of sleep duration, sedentary time, light intensity physical activity, and moderate to vigorous physical activity with adiposity. So this was the only health indicator that we had data available on with this data set. So these were specifically BMI, Z-score, and waist circumference. The other objective was to explore the associations between each behavior and adiposity relative to the time spent in the other behaviors. So as I mentioned, we used the Canadian Health Measures Survey, which included cross-sectional data on 552 children aged 3 to 4 years. These were recruited during cycles 2 and 3 of the Canadian Health Measures Survey. So you can see on the right here this pie that represents the proportion of time that young children are spending in a 24-hour period in each of the movement behaviors. So just about half of the day they're spending sleeping. They're spending about 31% of their time in sedentary behaviors, about 16% in light play, and about 4.5% of their time in at least energetic play or very energetic play. So the composition of the movement behaviors was significantly associated with BMI Z-scores, but not with waist circumference. The time spent in each of the behaviors was not significantly related to adiposity indicators relative to the other behaviors. So it really is the composition of the behaviors rather than each of the individual behaviors that was important. So you can see the reference for this study if you want to get more information or to really dig into what compositional analysis is. It's available here. So the story that this is telling us basically is, again, it's agreement with the idea that the whole day matters rather than the individual behaviors themselves. So in addition to the systematic reviews and the compositional analyses, the guideline development also considered elements from the GRADE framework in deciding on the direction of the guidelines and the strength of the guideline recommendation. So that really means the evidence is telling us a story. Now these other elements will tell us how strongly we would make the guidelines. So are they strong recommendations? Are they conditional because we're not quite sure what the evidence is telling us? So we considered all of these other elements as well. So first, the quality of the evidence. So those were our risk of bias assessments, examining inconsistency, indirectness, imprecision, and publication bias. That was assessed through the systematic reviews. The balance of the benefits and harms assessed through systematic reviews, guideline development panel deliberations also. So balance of benefits of following the guidelines versus the harms of following the guidelines. If we thought the recommendation was more likely to be beneficial, then we would have probably made a stronger recommendation, for example. We considered end-user preferences and values, feasibility, acceptability, and equity issues. These were assessed through a stakeholder survey, focus group meetings, and key informant interviews. And some of you may have participated in our stakeholder survey that was sent out by email. We also considered resource implications. This is the cost associated with following the guidelines, and this was also assessed through the stakeholder survey, focus group meetings, key informant interviews, and also a review of the literature. So Guideline Development Panel 2 was held following the synthesis and gathering of all of this information. So at this meeting, we reviewed, discussed, debated, and interpreted the findings from the systematic reviews and compositional analyses. We reviewed the results of the cost effectiveness and resource use analysis. We crafted the individual components of the guidelines. So we wrote separate guidelines for each behavior based on what the systematic reviews were telling us. We also crafted integrated portions of the guidelines that really pull in the idea of the 24-hour period and the relationships among each of the behaviors. We identified the research gaps that were found through the process of conducting the systematic reviews, and we planned the launch, dissemination, promotion, and evaluation activities. So as part of the stakeholder consultation process, I'll get into that a little bit. We'll talk about the stakeholder surveys, the focus groups, and the key informant interviews. Those all took place between the period of February and April of 2017. The results of the focus groups and key informant interviews can be found at this reference here by Nagin Riazi at UBC. The stakeholder survey evidence is included in the paper by Dr. Tremblay. That's the main guideline development process paper, also in a special supplemental issue. So the stakeholder survey was a cross-sectional survey in English and French that we developed to gather your feedback on the content and format of the draft guidelines, elements of importance to grade. So those are those things that we just discussed, values and preferences, also implementation of the guidelines, and we wanted to know who should be targeted to help activate the guidelines and implement the guidelines. So we were looking for your feedback on those elements. This was shared by snowball sample sent through our guideline development panel distribution network from March 24th to April 18th in 2017. The focus groups and key informant interviews were conducted in Vancouver and also in Ottawa. And these were conducted to examine stakeholders, which included experts in pediatric and family medicine, physical activity, knowledge translation, and research experts, as well as end users, so this was parents and early childhood educators. We wanted to look at their perceptions of the draft guidelines. There were 10 stakeholders engaged in telephone interviews, and 92 end users participated in focus groups, so there were 14 focus groups. And these were done to discuss the perceived clarity and need for the guidelines, potential barriers to their implementation, identification of credible messengers, and methods for dissemination. These were audio recorded and transcribed verbatim, and the group out at UBC conducted thematic analyses to look for consistencies among what was reported by the stakeholders and end users. Okay, so the guideline revisions and agree assessments then. The revision meeting was held in April of 2017. A subcommittee of the guideline development panel met to review all of that feedback and to revise the guidelines based on the feedback while also staying true to the evidence that was found in the systematic reviews and compositional analyses. The revised guidelines were circulated to the full group for comment and final revision. Consensus was achieved on the final guidelines. The revisions were translated into French. And then finally, when we had our final French and English versions, we had 4 independent reviewers conduct agree-to assessments on the entire guideline development process. This is not available yet, but soon in the new year, you can find additional details on the whole process on the CSTEP website in the Guideline Development Report, and it'll be available at this link here. So deliberation, consultation, assessment, and findings. So overall, throughout this process, we had more than 50 leadership committee meetings, 2 guideline development panel meetings where we achieved consensus on the final guidelines, an online survey with input from almost 700 stakeholders and end users from throughout Canada and around the world, representing physical activity and fitness, public health, healthcare, education, and research sectors predominantly. More than 90% were in agreement with the content and format of the guidelines. There was high agreement that the guidelines are feasible, acceptable, useful, cost-effective, and equitable across population groups. There was strong endorsement from the focus groups and the key informant interviews. Strong recommendations for all guideline statements. So that basically means that we really did believe that all of these other elements from grade were supportive of making a strong recommendation. And our AGREE assessors rated the guideline development process as very high. In fact, one of the assessors said that this was the highest assessment she's ever rated. So that was really good news. So the evidence for the guidelines was based on 4 systematic reviews, compositional analyses, expert consensus, stakeholder feedback, and methodological advice. And all of these things together form the foundation for the evidence that the guideline development process was based on. So now we have our set of guidelines. The next step is knowledge translation and guideline launch. So as you may know, the guidelines were launched on November 20th. A part of the process of getting ready for that launch was the development of a visual identity, public-facing tools and resources, and implementation and activation plans. So all of this took place between April and November of 2017. So this figure here, this 4, may be familiar to you as the iconography associated with the children and youth guidelines for the 24-hour period. So we have sweat, step, sleep, and sit representing the moderate to vigorous physical activity, the light physical activity, sleep, and then the smaller, kind of more downward-facing portion representing sit. And so this doesn't translate very well to the early years period because young children are not encouraged necessarily to sweat. We're not asking them to move for exercise purposes. They're just kind of moving at various intensities, and it's very sporadic. So we've made the decision that the 2 physical activity sections would be blended to just represent one movement section. So rather than sweating or stepping, we just have move. Also, all of the children included in this age group would not be able to step. So for that reason, that also didn't make a lot of sense. So you might be wondering why it was kept to 4 if there are only 3 behaviors that we're including here. And this is something that was debated, and it was decided based on a recommendation from one of our partners that received advice from their agency that keeping the iconography kind of similar across guidelines would help people to recognize them as a suite of guidelines. And as we do intend to create guidelines for adults and older adults, the decision was to be consistent with this sort of 4 shape, but recognizing that the literal translation of the 4 might not translate to each of the groups. Okay, so here we have the preamble that's associated with the guidelines. And this is really where you'll see the context for implementing the guidelines. Who does the guideline apply to? How can it be used? We're really setting the stage for the user of the guideline and for the end user or the practitioner to understand how they can apply the guidelines. We also have all of the funders, the funding partners listed at the bottom as well. On the right, we have the full guideline. So these will be presented on one piece of paper with the preamble on the front and the guideline on the back. And they're available as tear sheets at the CSAP website, or they can be ordered in hard copy from CSAP as well. So just to kind of break this down one by one for you, I know you can't read it in the big format. The infants are the first section of the guideline. So this applies to children less than 1 year of age. and then we'll have below the next group and then the next group. So here in the top green section, this is that top section for the whole page. The Canadian 24-hour movement guidelines for the early years, aged 0 to 4 years. For healthy growth and development, infants, toddlers, and preschoolers should achieve the recommended balance of physical activity, high-quality sedentary behavior, and sufficient sleep. A healthy 24 hours includes being physically active several times in a variety of ways, particularly through interactive floor-based play. More is better. For those not yet mobile, this includes at least 30 minutes of tummy time spread throughout the day while awake. 14 to 17 hours for those aged 0 to 3 months, or 12 to 16 hours for those aged 4 to 11 months of good quality sleep, including naps. Not being restrained for more than 1 hour at a time, for example, in a stroller or high chair. Screen time is not recommended. When sedentary, engaging in pursuits such as reading and storytelling with a caregiver is encouraged. Then you'll see at the bottom our integration message. So replacing time restrained or sedentary screen time with additional energetic play and trading indoor for outdoor time while preserving sufficient sleep can provide greater health benefits. So the next section down is for toddlers, aged 1 to 2 years. We recommend at least 180 minutes spent in a variety of physical activities at any intensity, including energetic play, spread throughout the day. More is better. So that includes a light physical activity as well as energetic play, and no real number placed on the energetic play. For sleep, 11 to 14 hours of good quality sleep, including naps, with consistent bedtimes and wake-up times. For sit, not being restrained for more than 1 hour at a time, for example, in a stroller or high chair, or sitting for extended periods. For those younger than 2 years, sedentary screen time is not recommended. For those aged 2 years, sedentary screen time should be no more than 1 hour. Less is better. When sedentary, engaging in pursuits such as reading and storytelling with a caregiver is encouraged. And for preschoolers aged 3 to 4 years, at least 180 minutes spent in a variety of physical activities spread throughout the day, of which at least 60 minutes is energetic play. So here we're trying to build towards the children and youth recommendation of including 60 minutes, so it's not such a dramatic transition. For sleep, 10 to 13 hours of good quality sleep, which may include a nap with consistent bedtimes and wake-up times. For sit, not being restrained more than 1 hour at a time, for example, in a stroller or car seat, or sitting for extended periods, sedentary screen time should be no more than 1 hour, and less is better. When sedentary, engaging in pursuits such as reading and storytelling with a caregiver is encouraged. Okay, so those are the guidelines. So now for dissemination, implementation, and activation. We created a proactive national media relations outreach plan. So this is, you may have seen the stories that were featured in the news. This is all a part of that effort. We have hard copy and e-distribution of guideline-related materials, and these can be found on the CSTEP website. We're planning a cross-Canada lecture tour. So members of our guideline development team will be going across Canada to give a similar presentation to this one to groups who request it or groups that we've solicited. We have this webinar that's targeted to different end-user groups and can be modified for those groups. It's developed and preserved online at the CSTEP website. All of the promotional materials, campaigns, and initiatives are available in both English and French. We have a suite of prepared messaging and communication tools, adapted visual identity, and a digital platform designed to serve as a foundation for a long-term, multi-platform, multi-sector, multi-jurisdictional, and multidisciplinary marketing and communication efforts to facilitate uptake and activation of the new guidelines. So this is currently being developed. You may be familiar with the Children and Youth Guidelines and the Build Your Best Day website, which is kind of a video game experience intended to teach those groups about the guidelines and how they can integrate them within their day. So the Build Your Best Day platform for the early years won't be a video game type of experience. It'll be more of the other end where tools will be featured to be used in classrooms, for example, to help implement the guidelines in various settings. And so those are under development currently, and they should all be available in March. And finally, we have the 13 research papers that were published as part of our systematic, or as part of our special issue of BMC Public Health. In terms of evaluation, this is all just beginning and still currently being planned, but our guideline launch metrics will be gathered, including traditional media impressions, social media activity, hard copy and electronic distribution, and general tone. So if the content of the media coverage was understanding what the guideline message was intended to be, and if it was favorable, we are reporting all of those things. We are assessing Canadian parents' baseline awareness of the guidelines so that we can see if any of the future efforts we make to promote the guidelines have any impact on their understanding or awareness of the guidelines. We're assessing beliefs among identified key stakeholders about the relative benefits of the 24-hour movement guidelines versus separate guidelines. And we are also collecting web analytics on our partner websites, so downloads, visits, things like that. So more research is required focusing on the dose-response relationships between physical activity, sedentary behavior, and sleep with health indicators. Few studies have used valid and reliable measures of sedentary behavior or sleep focused on infants or toddlers, or controlled for important confounders. So we know that some of the studies were looking at adiposity, for example, but didn't control for diet or discuss diet at all, and those need to be addressed because there's such a strong relationship that we know between those variables. Some health indicators didn't have data on their relationship with our movement behaviors. So specifically, we don't know very much about fitness, bone and skeletal health, cardiometabolic health, or risks and harms. Risks and harms is something that isn't typically reported in research on physical activity or sedentary behavior, for example. So this is something that we need to start doing more frequently so that we can say that following the movement guidelines is associated with no risk. Limited evidence is available on the combined effects of physical activity, sedentary behavior, and sleep on health in the early years. Future research should focus on examining the combined effects of these behaviors while developing innovative ways to analyze the 24-hour data. So we've already looked at surveillance and monitoring in terms of the proportion of Canadians following the guidelines. They are described in our supplemental issue in the paper by Tremblay et al. That is describing the process. So generally, the surveillance recommendations for physical activity are that infants should average a total tummy time per day of 30 minutes or more while awake. Someone else mentioned earlier that this is important that it's supervised tummy time, and it is included in the preamble that, yes, this tummy time should be supervised. So hopefully that is conveyed and people don't skip over the preamble and only look at the guidelines. For toddlers, the average total physical activity per day is at least 180 minutes with some energetic play. For preschoolers, they'll be considered as meeting the guidelines. If their average total physical activity is at least 180 minutes, and if that includes at least 60 minutes of moderate to vigorous physical activity. For sedentary behavior, infants and toddlers that are younger than 2 years will be considered as meeting the guidelines if their typical day includes no screen time, and if their time restrained is 1 or fewer hours at a time. And for toddlers that are 2 years or older and preschoolers, their average sedentary time per day should be 1 hour or less per day, and their time restrained should also be 1 hour or less per day to be considered as having met the guidelines. For sleep, I think this one is pretty straightforward. So for infants that are 0 to 3 months, their average total sleep duration in a 24-hour period should be 14 to 17 hours to be considered as meeting the sleep guidelines. For 4 to 11-month-olds, then the average total sleep duration in a 24-hour period should be 12 to 16 hours. And this includes naps. Toddlers, the average total sleep duration should be 11 to 14 hours. And preschoolers, it should be 10 to 13 hours. Again, these can include naps. So we did do some surveillance analysis to see what Canadian children are doing in terms of meeting the guidelines. And so if you look at this Venn diagram here, we can see that this 3.3 up to the top left of the square, that represents the proportion of Canadian children that are not meeting any of the recommendations. And then if you look in each of the circles, then you can see that if you add up all of the numbers that are in a circle, that represents the proportion of children who are meeting the guideline for each of the separate movement behaviors. So we can see that 84% are meeting the sleep duration recommendations, 24% are meeting the screen time guidelines, 62% are meeting the physical activity guidelines. In the interior sections, you can see the proportions that are meeting combinations of the recommendations. So only 12.7% of Canadian children are meeting all 3 of the movement behavior guidelines. So these data are specifically looking at preschoolers in a nationally representative sample of Canadian children. It was taken from the Canadian Health Measures Survey. So generally not doing so great, and it looks like the screen time is really what is pulling that number down. So kids seem to be doing pretty well in terms of physical activity and not so well with screen time, and again, pretty well with sleep duration. So the results of this study, if you're interested, you can see more details in our special supplemental issue of BNC Public Health. So we don't have any nationally representative data for the other age groups, but we were able to get data from a small sample of toddlers in one specific location in Alberta. So this isn't generalizable across Canada, but it does give us an idea of what these relationships are, and in terms of surveillance. So a similar pattern you can see here. So very few kids are meeting all 3 of the guidelines. Just about 12% of toddlers are meeting all 3 of the guidelines. And then looking at the combinations of movement behaviors, it looks like screen time again is really where the issue lies. So very few children are meeting the screen time recommendations specifically. These data are published in our special supplemental issue, and so you can look here for more information. So the plan for updating and revising the guidelines is that every 10 years we'll do an update of the evidence that has emerged since these guidelines were developed. The only exception to that is if something becomes available that suggests we need to reconsider where the guidelines are, if there's some evidence that kind of indicates that something might be in a different direction, or maybe we should dramatically change where our numbers are, then we would consider moving that timeline a little bit sooner. Okay, so I mentioned that we had international collaborators involved in the development of our guidelines, and in fact, they did go back and launch guidelines of their own that focus on a 24-hour period in some cases. So we had a collaborator from New Zealand, and while they didn't follow our process exactly, they did use our systematic reviews to come up with their own 24-hour guidelines. You can see here the sit less, move more, and sleep well recommendations for under 5. Also in Australia, they did follow our process, and in fact, they used our systematic reviews, they used our compositional analyses, and they adoloped it. So adolopment is a word that doesn't exist in the dictionary, but it does in terms of the grade framework, and it describes the process for adopting and adapting guidelines. So what they did was follow our evidence, hold their own guideline development meetings, look for new evidence. Since we developed ours, they looked for more recent evidence. So a very small period of an update, but they did an update nonetheless. And then they developed their own guidelines. So they look very similar to ours. There are very few differences, and many of those are just kind of cultural preferences for language. There's nothing really, really important that's the difference here. So all of our surveillance recommendations would be usable by their group as well. So these guidelines were actually launched, coordinated with ours, and they released theirs the day after we released ours. And this is kind of an exciting development for Louise, who was able to join this process. The World Health Organization is also developing 24-hour guidelines currently. And this came about because they had a landmark document on the report of the Commission on Ending Childhood Obesity that was released last year. And in that document, they included a recommendation specifically calling for 24-hour guidelines. So in fact, they have started the process. It's just underway for updating our systematic reviews and developing their own set of guidelines.
Well, thank you very much, Casey, for all that research information. I know that was a little bit heavy duty, and I can assure you, as being part of that guideline development panel, that there was a lot of evidence being discussed, and every word in the guidelines and in the preamble was weighed and discussed, and making sure that it was evidence-based. So they didn't just come up with these guidelines, pulling them out of a hat, and especially the adjustments and doing the 24-hour aspect, integrating the 3 aspects of movement, physical activity, sedentary behavior, and sleep was quite a process, as you can see. And yet there is still more research that needs to be done to evaluate certain aspects. And it's probably also that group age has not been studied as much. There's been more done in children and youth, and it's easier to reach them through schools at times. But the infants, toddler, preschooler, there hadn't been as much research. So it is important to continue to do more research. But now we're feeling much more solid about this evidence. Now, I know many of you are very practical, and you think, okay, well, now what can I do with this? Because it's nice to have all the guidelines, but what can we do with them? And I just want to preface this by saying I don't have all the answers. We did discuss some possibilities, but I would like to hear from you first, depending on where you work and what you do. What do you think you could do with the guidelines, or perhaps what you have done with the previous guidelines that could be done with these updated guidelines. And the way we will do this is that you can actually type your suggestion into the conversation box and give us ideas, and then we'll discuss what we had considered might be possible. So I'd like to encourage you to type some ideas. Yeah, that's great. I see it's starting to happen. And if anybody has questions also for Casey or for myself, you can post them in that box, and we will discuss a few minutes the development, the implementation of the guidelines. So I'll give you a minute to do that. And as you can see, I did post a few links as Casey was speaking. And for instance, that BMC Public Health link has 13 research articles that has all the systematic reviews. If you really want to dig around and find out more about why did they say that and what is the evidence behind it, that's where you can find all that information. And I know at this point the CSEP website does not have all the pieces put together, but it will happen over the next few months, that there will be more tools to help support the dissemination, and participation is also helping on that. So Hamilton Public Health Service is asking if there's a low literacy, larger font version for parents. No, there isn't, and Casey, you can tell me if you know any more than I do about any plans for that, but that is perhaps something that health units could do if they see a need for it, but there is currently no low literacy. Casey, do you want to add anything to that?
Yeah, sure. So certainly not a larger font version. The guidelines themselves were intended to be low literacy, where we see that the preamble is a pretty high level, and that was not, although it's coming together as a package, that part was developed for the person who would be giving the parents the guidelines. So that would be for your understanding rather than the parents. And then the guidelines themselves should be easily digestible for parents. We haven't actually ever, I don't think we've ever heard anything about a larger font version for parents, in fact. So
yeah. But there's nothing that prevents you from maybe, it could be a little overwhelming to seeing the infant, the toddler, the preschooler, and maybe have it for parents that you're just promoting one aspect, you know, the infants or the toddlers, because that's what parents are interested in, are about kids their own age, and then there's a little bit less text around perhaps that way. I see that Joelle from Porcupine Health Unit has mentioned that they use the guidelines with their family health team to distribute, inform parents during the visit, and discuss with them, promote it on their Facebook page and with the daycare partners, and that's great. Lots of ways to disseminate that are very low cost, and it's great with families to discuss the barriers that they see to implementing the guidelines, especially when you can be one-on-one or through small discussion groups, because they may say, oh, well, yeah, I have to use the screen with my kids when I get back from daycare and I'm trying to make dinner. So it's good to help them problem solve, or have them say, well, what you can do, and sometimes with a group of parents, others will have a suggestion that will help them, and it might make it more realistic that way. Melissa indicated that as a parent, she's on various parenting forums, social media platforms, and when she answers questions by parents, she could provide reference to the guidelines if it applies to questions. That is fabulous, because then, yes, it's very practical to the needs that they may have in the questions. Emily suggests sharing with parents, and it's true that the screen time sedentary recommendations are new to most parents. And I have to say the previous version of guidelines was not necessarily promoted that widely. A lot of parents are not aware of it, and with that age group, it's a whole new set of parents coming into the system anyway, and there's zero screen time before age 2, for instance, and no more than an hour after that. They are not aware of that, and if I think of typical kids movie, it's already over an hour, if most Disney movies and all that, so it's important for them to be aware of it and to understand why also. Erica from Healthy Start suggests that they are planning to incorporate the new guidelines into their Healthy Start training, targeting early learning center, pre-kindergarten, Head Start, family resource centers throughout Saskatchewan. And I know Healthy Start is doing a lot of great work in both official languages, by the way, and you check out what's coming out of their website. That's great. And Marty from Porcupine Health Unit. Okay, so it's a bit more of a question. Any change in one behavior must be done at the expense of the other behavior. Increasing light and energetic play reduces the sedentary behavior. But she says, what I don't understand is why sleep would be included as part of this continuum. Sleep would not necessarily be reduced. And Casey, maybe you can speak to that.
Yeah, so we don't want sleep to be reduced, but we are seeing that in the other age groups. So this was originally not conceived of with the early years children, but in the other age groups there is a big problem of actually not enough sleep. And so, in fact, we would want to increase sleep there, which would come at the expense probably of screen time, where kids might be staying up too late talking on or texting or whatever they're doing with their screens. So if you think about this continuum, it's not just for this age group really, and that each of these behaviors is intended to, or it's conceived of as making up the full day.
Yeah, we want to make sure that sleep is preserved through all that.
Exactly.
Amanda mentions that beginning discussions in child care center in their region would be important, and just sending information doesn't necessarily work, and it would be great if it could be mandated for licensed child care centers, just like the food group requirements. That's a great point, and we will discuss that a little bit more when we have a specific suggestion. That, for instance, licensed child care are mandated to have children outside and outdoor play for a minimum of 2 hours a day, but sometimes that gets curtailed because of weather. It's raining, it's too hot, it's too cold, and that is very, very unfortunate. And sometimes the educators will think, well, getting dressed and undressed is part of that. Really, having children outdoors is so important because when they're outdoors, there are no screens. It's much harder to be sedentary. They're much more likely to be active. So Wafa from the Pinecrest Queensway Community Health Center shared the guidelines with the families when she's doing home visit and incorporates it in parenting workshops. Amanda suggests that, yes, can we ask doctors and healthcare providers to give it to all new parents? That would be fabulous. And that might be something that, as, say, public health may be able to distribute some of the resources to the healthcare providers and get the message out to them. I know there are often strong links with healthcare providers and public health. And someone from the Child Youth Network is agreeing with that one. Or doctors prescribing it. That's getting even stronger. Well, that would be great, but it could be part of the, when parents ask questions about development of their child, that could be part of the conversation that healthcare providers have. And I'm glad to hear that Waterloo Public Health in their family birthing unit, it could be handed out as part of their postpartum package. And definitely, yes, it should not just be, okay, we're going to do a workshop on physical activity and sedentary behavior and sleep, but it should be integrated as part of everything. A little bit like the food guide is often integrated in various aspects of healthy living. And yes, and then, incorporation into the licensing requirements for child care centers. So those are all great ideas. I think there are a few more coming in, but I am also conscious of time. So I will just go through some of the suggestions that our little group had come up with as possible ideas that may work for you also. So if you're a public health practitioner, we would encourage you to read the background documents to master the content. It may be a little bit heavy duty to go through all the the 13 research article, but if you're only reading one, I would suggest the one from Mark Trombley that has the whole picture of how they were developed. It's the first one at the top on that BMC Public Health link that I sent, the Canadian 24-Hour Movement Guidelines for Early Years and Integration of Physical Activity, Sedentary Behavior, and Sleep. And it explains the whole thing. But if you are specifically interested in sleep, yeah, by all means, go and see what's in there. You could disseminate the press release to local media, so I did put the link. It's available on the Participation website. You can modify it and send it to your local media. You can disseminate the guidelines to social media platform, maybe take chunks of it, as I suggested before, that for infants, for toddlers, for preschoolers, and engage a conversation with parents on that. Having a link directly to the guidelines from your website, those are inexpensive or free ways to disseminate. And you could provide hard copies of the guidelines in the waiting room, workshops, displays, often the health fair that might be happening on different areas. And you could also offer 24-hour movement workshops to Early On, which is the new early years centers of Ontario, or in other parent-child programs. For instance, all provinces have CAPC programs, Canadian Action CAPC for children that are available, and I'm sure other areas have different names, different provinces have different names for those. And it should be integrated in all presentations, maybe prenatal education classes even, that handing that out for, the whole tummy time. That's a whole new thing. To have 30 minutes of tummy time is new for a lot of people, but it has been proven that, yes, that is a good way to develop the strength of the upper body and help the children. And providing professional development to other service providers such as daycares, and supporting those policy efforts in daycare, school, other venues, because once you have policy in place, it will stick. It's more than just handing out a flyer. It will be part of the routine automatically. And then explaining to, okay, well, those are evidence-based guidelines. And really, to a certain extent, yeah, the food guide is an example of what has been done in the nutrition area, and the similar can and should apply in physical activity, sedentary behavior, and sleep. Now, if you're an early childhood educator or teacher, you may find different ways to support the guidelines. At this stage, it doesn't sound like physical activity is the biggest issue for toddlers, preschoolers, but it's still good to continue to increase physical activity, and remembering that 180 minutes is the minimum required, but more is always better. So encouraging children to be active in all settings, and there are all kinds of websites that have ideas for activities, reducing the screen time, and ensuring insufficient quality sleep, and ensuring your programming meets the guidelines. Especially in daycares, I think of a lot of daycares where children get dropped off at 7 o'clock, 7:30 in the morning, get picked up at 6. Well, they should be meeting the guidelines within that 10, 12 hours that they're there, because there's not a whole lot of chance for the parents to provide extra physical activity for their child once they get home. If anything, they might be more likely to use screens at that point, so the less they can use them in childcare, the best. And aiming to reduce that sedentary time in the programming. And through your physical activity promotion, emphasizing the physical literacy building blocks with young children, the physical competence so they can do the movements, the motivation that they want to do them, and having the confidence that they can do them is a good way to have those building blocks in place. It's important to communicate the guidelines to parents, because if they don't know them, understand them, they don't understand why their child has to be outside even when it's cold, when it's raining, and it's important to do that, and why there are no screens, and why they should also do the same at home as much as possible. Ensuring that the parents provide the appropriate clothing for play in all settings, having extra clothing, footwear available, and I think a lot of daycares and preschools already do that. And supporting the development and implementation of policies. I know that came up in the long list of suggestions, but really the full 2 hours of outdoor playtime, providing an environment that's conducive, inspiring for activity, and maybe if it has to be a little bit sheltered from the wind or sheltered from the rain, then they're still outside and doing something. And being a role model is important also. The children look up to the adults that are caring for them, and if the adults are all just standing around sitting, that's not so inspiring for children. They want the adults to be running around with them and doing things, and be a good role model is important. If you're an early years facilitator, so by that I mean parent-child centers, obviously communicating the guidelines to the parents and emphasizing that the whole day matters, helping parents find ways to remove these obstacles, these barriers that they see, and integrating their guidelines into their family through workshops, posters, discussion, newsletters, because that is your role. I know you're good at that. You know the families, you know what they might be dealing with and what's possible for them, and helping them just move a little bit further in that continuum. And ensuring the programming supports the guideline. I know a lot of early years centers tend to be indoors, for instance, and it's important to add some outdoor playtime and some physical literacy activity, active outing, active circle time, and you know, as possible, depending on the center, offering some sleep opportunities, depending on, of course, if it's a full-day program or whatnot, and mentioning the quality sedentary activities. And that's new from the previous guidelines, that they didn't really allow for quality sedentary activity, but the research is showing that the benefits of quality sedentary activities such as reading with the child and doing crafts, and now there's more research that needs to be done on that, but we can see the benefits of it. And promoting local activities to parents. At this time of year, there's a lot of free skating happening in arenas. There might be fun runs, rodeos, walking trails, and outdoor play in natural settings. I'm thinking of tobogganing and just going for hikes in the woods, and children are more likely to be active, and again, being a role model through that. If you're a recreation leader, try to reduce the sedentary time in programming, that children are not waiting for their turn so much, and making sure children of all abilities are included, because that is what is needed, especially the children that perhaps don't feel comfortable or have not had the support in their home environment. Well, making sure that they are feeling included in the activities. And through that, it's part of the physical literacy building blocks, building that physical competence, the motivation, and the confidence. You can also encourage the parents to continue to be active with their child outside the program time. I'm thinking of these swim lessons that last an hour or half an hour, and then nothing for a whole week for the child. Well, it might be good if the parents take their child to the pool also and do some swimming with them and be active, and the child will also see this is all part of life. This is what I do with my parents, and that could be for skating, for anything else. And supporting that development and implementation of policy, the outdoor play space, and that's more municipal sphere, affordable programs and reduction of screen time into programming, and support, a schedule that supports sufficient sleep. And that's where I do see a strong link with recreation, and I've given the example that when my children were young and I was at home every other day with them, and I wanted to take them to preschool swim and preschool skating, but it was happening at between 1 and 2 in the afternoon or 2 and 3 in the afternoon, and that was nap time for my kids, and I did not want to sacrifice the nap and really break the routine that is so important also. I lobbied at the time, and they did change it to 12 to 1 during lap swim, which is better, but you know, that's something to keep in mind when the schedules are done for recreation. And of course, being a role model yourself. If you're a healthcare provider, and I know some of the suggestions did come up earlier, for a healthcare provider, yes, it would be great if there could be hard copies of the guideline in the waiting room, and perhaps that's where public health or others can help make that happen. And encouraging the healthcare providers to discuss the guidelines with the parents and help them overcome those barriers, because I think when it does come from a healthcare provider, it probably has a lot of resonance to it. And encouraging that outdoor time as a way to increase the activity time. If they're outdoors, they're going to be more active. And as always, being a good role model. So we can all have a role to promote the guidelines, whether as citizens and municipal leader, parents, and we can promote it to our colleagues, our family, our friends, and all the parents of young children that we have around us. I see that Lynn has put something in a conversation, a great webinar featuring Dr. John Carney from University of Tea and McMaster. I know he's recently switched from McMaster to University of Toronto, speaking about how physical activity enhances child development. So thank you very much for providing that. And yeah, and somebody else asked if other languages were being considered at this point. No, but well, they are being considered. I know it's not available, but those are all great ideas to promote the guidelines a little further. Now I will give the microphone back to Casey for a few minutes to talk about additional material and resources, and shortly after that we're going to wrap up the webinar. So Casey?
Okay, thanks Louise. So as I've said many times, we have papers included in the supplemental issue of BMC Public Health. That is all of the scientific evidence or process-related information for you. So this includes the process and outcomes paper, 4 systematic reviews, the compositional analyses paper, stakeholders consultations, the prevalence papers for preschoolers and toddlers, the Australia development paper, 3 Australia prevalence papers. So this is explaining how Australian children are meeting the guidelines. In addition, we also have tear sheets that are available for order at CSEP. You can also get the guideline documents online at CSEP if you don't want to order the hard copies. The guideline development report is currently being developed, so that'll be available in the new year, and that will outline at exhaustive detail the process that we followed. The webinar with voiceover from Dr. Tremblay and from Dr. Chaput in French and English are also available at the CSEP website. If any of the terms I've used are unfamiliar to you, there is a French and English glossary also at the CSEP website. And a digital platform. So this buildyourbestday.com, where you'll be able to access various resources that are currently being developed. So to conclude, the whole day matters. That's really the point that we want to get at. And so this idea of focusing on physical activity alone or sleep alone or screen time alone, really does matter what the whole composition of the day looks like. So having one really good day for being physically active isn't enough. Not achieving the screen time recommendations will diminish the positive relationship between the physical activity and the health outcome. We also want to emphasize that this is on a daily basis. So there are times when maybe you won't be able to where parents might not be able to have their children meet the guidelines every single day, but generally this is what we should be aiming for. So I want to acknowledge those who were involved in this process, the research experts, the stakeholder groups and knowledge users, our international collaborators, and methodology consultants and project management teams. And also the organizations and funders that were associated with this project. So the Canadian Society for Exercise Physiology, our group at HALO with the Children's Hospital of Eastern Ontario Research Institute, the University of Alberta and the Faculty of Physical Education and Recreation, Participation, and the Public Health Agency of Canada. And so here are all the references that I've mentioned throughout the presentation, and most of those are actually our BMC Public Health papers or are included in those papers. And that's all for me. Thank you.
Thank you very much, Casey. That was great, and thank you for all that rich information. And I want to also remember to thank the Physical Activity Resource Center from OFIA who was co-sponsoring this webinar. Now, when I close the meeting window, you will have an evaluation link, and I would really appreciate if you fill that out. I will also send an email, a reminder to do that. And if you have any questions, just email us. We'll be glad to help out. Thank you very much.